Hi, I'm Dr Pipin Kojodjojo. I'm a cardiologist at Asian Heart and Vascular Center. But among all the cardiologists here, I specialize in heart rhythm problems. So I'm also called a cardiac electrophysiologist.
Let's talk about tilt table. What is a tilt table test?
So a tilt table test is actually a non-invasive test where we want to study the patient's blood pressure and heart rate responses to various stimulus. So how do we stimulate the blood pressure or heart rate? We basically either ask the patient to stand up for a prolonged period of time, and we may even give them some medication to see how their blood pressure and heart rate respond to the stimulus, right? The test is non-invasive. It's been around since the 1980s, and it is quite commonly done at the HVC.
Why would a doctor order a tilt table test?
So a tilt table test is typically used to do an investigation for patients who have dizziness, or if they have blackouts, or they have quite erratic changes in their blood pressure, which we don't understand the reason for. And so the tilt test will give us lots of information about what the problem is and what are the best treatments for the conditions that the patients have.
What conditions does a tilt table test diagnose?
So the most commonly diagnosed condition on a tilt test is what we call vasovagal syncope. So this is where people are prone to fainting unexpectedly and quite often, right? So that's the number one diagnosis. We also sometimes diagnose orthostatic hypotension. This is where the blood pressure changes quite a lot. Okay, and then finally, there's also a condition called POTS, which stands for postural orthostatic tachycardia syndrome. This has been seen more commonly after the COVID pandemic, and this is also diagnosed on a tilt test.